All right, we're going to go ahead and get started. There may be a few more people that jump on as we're going, but to keep everybody's time in mind, we're going to get started. Today, we're going to go through YQA Level 3. On Thursday, we are also doing YQA Level 3, but we're going to do um, a Jeopardy game with that. So if you want to play Jeopardy, come back on Thursday and use what you're learning tonight to play a fun game. Okay, so um, what do you guys think YQA is? You can either unmute yourself or answer in the chat box. What is YQA?
Youth quality assurance.
Good. It is youth quality assurance. What do you think that means?
Youth quality assurance tells us how to take care of our animals and how to take care of the meat.
Good. So quality assurance is something that is a class that we take so that we can make sure that we have better meat. But quality assurance literally means a promise or a pledge to our consumers that the meat that they are eating is safe, healthy, and good tasting. Um, so when we take this class and when we raise an animal in 4-H or FFA, we're making a promise that the food from our livestock will be the highest possible quality, and we will do everything we can to make sure these products are safe to eat. And it doesn't matter how many animals you raise, whether you're raising 1, 2, 10, 100, or 1,000, or what species or breed, you are producing food that will end up on somebody's table. And you are just as responsible as any other producer to make sure that that quality meets the consumer's expectation. So quality assurance was developed um, for pork and beef in the 1980s, and it is required for many livestock producers across the nation who produce animals. And it is based on something called HACCP, which stands for Hazard Analysis Critical Control Points. There's also a dairy quality assurance and a sheep quality assurance. Those just popped up on there. So there's all sorts of different quality assurance classes that are required for producers across the nation to make sure that the meat that we get from grocery stores or we buy privately are safe and good quality. So who thinks they have an idea what HACCP means or stands for? What do you think the hazard analysis critical control points are? No guesses? Okay, so HACCP helps us to identify potential hazards before they become hazards. Um, and these hazards are things that can affect the safety and the quality of the food, and where those hazards or problems can occur, and then helps us set control points to prevent those potential hazards from occurring. It also helps us monitor to make sure that things don't go wrong and to make sure that we are missing those hazards and that if something does happen, we can fix it. So HACCP is where we get our record keeping from. So we have quality assurance to improve the overall food quality, to make sure our consumers are confident that the animals we're producing are of good quality, improve the care and management of our animals, and to overall increase the product value. And most importantly, it is simply the right thing to do. Okay, so quality assurance, here are some numbers. Injection site lesions were common before quality assurance was started in the late 1980s. 20% of beef carcasses had an injection site lesion. Who knows what a injection site lesion is?
An infection where the needle was put in.
Good. Yeah. So it is exactly that. Um, if a needle has a burr on it, or if it has some sort of contamination, or if the animal has an allergic reaction to the medication, it can cause an infection, which turns into an abscess and then it scars over. So you will either get an abscess in your meat or a scar tissue in your meat. Um, and so a lot of beef carcasses that were going to butcher had injection site lesions. In 2000, less than 3% of beef carcasses had injection site lesions. Drug residues were also somewhat common, not as common as injection site lesions, but about 7% of carcasses had drug residues in them. What are drug residues?
A trace of some sort of drugs that someone put in that animal at some point.
Exactly. So it is um, a little bit of that medicine or vitamin or mineral. In most cases, we're talking about an antibiotic or a vaccine. It's just a trace amount of that that is left in the body tissues. All of that, once you inject an animal, you want that drug to go throughout the body to heal the animal if they're needing antibiotics or whatnot. And so we need to follow withdrawal times because we want that antibiotic or medication to heal the animal, but we want to make sure that that drug has completely left the animal's body tissues before we take them to butcher. Okay, so this here is a picture of an injection site lesion. You can see where the needle went in, and you can see the scar tissue that was formed from an improper injection. So this could have happened from several different things. It could be this was supposed to be a subcutaneous. It looks like it's not very far from underneath the skin, so that would be my guess. It was supposed to be a subcutaneous shot, and it got put a little too deep in. It could have been an allergic reaction the animal had. It could have been a number of different things, but this animal had a reaction, so you can see the scar tissue from where the needle was inserted, as well as where the drug or the medication initially spread out as it was being given to the animal. And it probably was an abscess before it scarred, but the abscess healed before the animal was butchered. So those things have decreased drastically, but we want to make sure that we continue to have a reduced number of injection site lesions and drug residues, or to reduce them even more. So it's really important that we continue learning about quality assurance, whether we're a youth producer or an adult producer. We also want to make sure that we're providing information to consumers for traceability, and this is where HACCP and record keeping play a big role. So tonight we're going to talk a lot about record keeping, and then we're also going to cover proper injection. So we need to remember we're raising food, and that everybody that comes into contact with that animal is responsible, and that we need to keep learning to make sure that we're following safe practices. Everything that you do to your animal does affect the quality of the food supply, and it can also affect the consumer's image of the livestock industry, as well as youth programs. So what happens if you sell your animal at the junior livestock sale and your buyers have a really good experience with the meat that you provide for them?
They'll want to come back to get more.
Definitely. And what about if they have a bad experience with your meat? Say it had an injection site lesion in it.
It will want to buy something from you again.
Exactly. And they might not want to buy something from the livestock sale again. So it's really important that we do our job to provide the best quality animal that we can. Um, so tonight we're going to talk about records and then medications, proper storage, working with our vet, and then how to administer different types of medications. Um, so record keeping should be simple, but it also needs to happen. So the best thing to do is to write as much information as you can down when you treat an animal. Even if you just write down which animal you treated and what drug you used and how much you did, you can go back and fill in the blanks later. So we're going to use an acronym called CALCULATE to remember what we should be recording when we give an animal an injection or a medication. It doesn't have to be injected. So the first C in CALCULATE stands for calendar. And this should be the record the date that the medication was given. And you may need to record several different dates if you're giving the medication more than once. The second letter is A, and that stands for animal. And this is where we're going to use our identification. In level 1, we learn different types of animal identification, and so you can use multiple different ones. Most of your animals should have ear tags, so that's probably the identification form you're going to use. So you'll want to write down the date that the shot was given and the ear tag number of the animal the shot was given to. The next letter is L, and this L stands for label. We want to make sure to read the product label and record the product name. What is the product name of this particular drug that's on the screen?
Noromycin?
Yep, Noromycin 300 LA. You could just put Noromycin down. What about this product that's on the screen now?
So, Vetrimic Plus.
Yep, Vetrimic Plus. Okay, so the next C stands for calendar again, but this time we're going to want to record the withdrawal time. Who knows what a withdrawal time is?
The withdrawal time is the time that the drug needs to completely get out of the system of the animal.
Exactly. So on this particular drug, it is in the box that's highlighted in yellow, and it says do not treat cattle within 49 days of slaughter. So this has a withdrawal time of 49 days. And it does not, it goes on to say that it's not approved for milk, and so you won't want to use that for dairy animals. So on this, we can record this one of two ways. We can either write down the withdrawal time, 49 days, or we can count out 49 days from when we gave the injection and put that date in the box. We already went over this. You guys answered it correctly. It's the amount of time that it takes for the drug to be broken down and completely leave the animal's body tissues. Okay, so the U in calculate stands for you. And this is just whoever gave the shot, whether it's you, your parents, grandparents, a family friend, or a vet, record who gave that medication to the animal. And then the L stands for location. Record the location where you gave the injection. So whether it was a feed, you can put orally, or if you gave it on the right side or the left side, and most likely you're going to be recording the neck if it was an injection. And the A stands for amount of medication that was given. How much did you give the animal? So how much do you think is too much to give? Is there such thing as giving an animal too much in a shot?
Possibly if you don't give them the right amount. It says to give them.
Good. So this is kind of a tricky question. So yes, you don't want to give them more than the medication says to give them. For a follow-up question, now that we know that our label is going to tell us how much to give, if our label tells us to give 20 cc's, should we give that in one shot or should we break it up into more than one shot?
Break it up into more than one shot, I would suggest.
Yep, exactly. So for cattle, we don't want to give more than 10 cc's per site. So if your injection requires 20 cc's, you would want to give that in 2 doses. If it requires 12 cc's, you would still want to break that up into 2 different doses, and you would want those doses to be at least 4 inches apart. So either 4 inches apart on the same side of the neck or 1 on each side of the neck. For smaller animals, you don't want more than 5 cc's per site. So you would also want to break those up if you had to give more than 5 cc's per shot or per dose. The T stands for type of administration. Did you give it orally, in the muscle, sub-Q? What type of shot did you give? And then E is extra, and this would be any extra information that you use to decide how much of the animal or how much of the particular medication you give your animal. So if you're using a weight to calculate how much medication, you'll want to record the weight. It's always a good idea to record the symptoms and temperature. If you were given a prescription from a vet, it's good to record that it was prescribed by a vet and what the vet's name was and their contact number. And you may also want to record other information depending on what the circumstances are. There are lots of different places that you can find records. We can print off some forms in our office for you if you would like, or you can find them online from either like the Pork Quality Assurance Board or the Beef Quality Assurance Board, or you can even make your own. Here's an example of one for beef. Here's another example of one. And another. This one has a spot for you to mark where you gave the injection. And just another example here. So the required information when we are giving our animals medication is, again, we're going to go through calculate one more time. The date the medication was given, the animal ID, the product name, the withdrawal time, who gave the medication, where the medication was given, how much was given, and the type of administration. The E on calculate, which stands for, what does the E stand for?
Extra.
Extra.
Extra, good. The E is not required. It's just a recommendation. It's always good to record more information than is required. I just want to throw in a quick note for anybody that jumped on after we got started. Please sign into the chat box so that we can make sure to give you credit for coming tonight. Next, we're going to talk a little bit about storage and handling. It's a good idea to properly store your medications. True or false? I should store my livestock vaccines and medications in my family's refrigerator.
It kind of depends on the medication itself, like if it requires to be refrigerated or not.
Good. That was a trick question. So some medications don't require refrigerated. But the answer was false. We should not keep our medications in the same refrigerator that we keep our food in.
Okay, now they can hear us. Oops. Sorry, people.
Why do you think we shouldn't keep our medications in the same refrigerator we keep our food in?
Hmm.
So there isn't any way they can contaminate the food in your refrigerator.
Good. We don't want to contaminate our food. Okay, so, oh, I thought there was another slide on that. There's not. So on the vaccine or the medication, it will tell you how to store it. Most of the time, they want to keep it cool and dark. Sometimes it needs to be refrigerated, sometimes it doesn't. And so the storage of that really depends on what the medication tells you to do as far as storing that. Okay, so all drug labels should contain all of these different things. So it should have an expiration date, a lot number, dosage, application method, any cautions or warnings, as well as a withdrawal time. It may have the product name as well as a trade name, precautions, and active ingredients. So one thing that is not on, or a couple things that are on the label that are not in our calculate that are good things to add to the extra section are the expiration date and the lot number. Why do you think you would want to keep the lot number recorded? Any guesses on why you would want to keep the lot number recorded?
That's what I can think of.
Sometimes products have a recall, and so if that happens and you've recorded your lot number,
I have a
then you
question.
can easily look up if you've used that. Yeah, what's your question?
So if you get like a product, like, and it's not for like the right animal, and you don't know, will it like be bad?
That's a great question, and we're actually going to talk about that in just a couple minutes. So I'm going to hold off on answering until we get past that section, and then if I don't answer it thoroughly enough, ask again and we'll try and answer.
Okay. I can't believe they heard you.
Okay, so we're going to talk a little bit about needles and syringes, and then we'll talk about reading the label again in just a second. So we want to make sure that we use disposable syringes, or if we're using reusable syringes that they've been sanitized. The disposables are the best because they're already sanitized and they're easy to use. And then we also want to make sure that we're checking for burrs, which are pieces of metal on the tips of our needles. If our needles have burrs on them, we should discard that needle and get a new needle, because those needles are starting to dull. And we never want to use a bent or dull needle. Why don't we want to use bent or dull needles?
They could get stuck in the meat.
Good, yeah, they can break off and get stuck in the meat, and nobody wants to eat a needle when they're eating a steak, do they?
No, that would be bad.
It would be bad.
Yeah.
We also want to make sure that we properly dispose of our needles. We don't want to just throw them in the trash can. They should go in a sharps container, and you can use a sharps container that you get from a medical supply or a vet supply source, or you can just make your own with an old laundry detergent bottle. There's a couple examples here, and you just need to make sure that you write that it's household sharps or some sort of sharps across the side. And then when you're done, when it's part way full, you can tape across and take it to your vet, and they'll know how to dispose of it. Okay. It's a good idea to work with your veterinarian to build a relationship, because the better relationship you have with your veterinarian, the better able they are to help you when the time comes. And it's really important to use prescription drugs only through working with a vet. So what is a prescription drug?
A prescription drug is like a shot.
It can be, yeah.
It's medicine prescribed by your vet.
Yep, it's medicine prescribed by your vet. So there's a couple different types of medications. There's over-the-counter or prescription. Prescription drugs are usually under the prescription guidelines because of the margin of safety for those prescriptions, or the difficulty of identifying a disease that the prescription is used to treat. So we're going to talk about a little bit about drug uses, and this is where that question from earlier might get answered. So it's really important to use the drug exactly as is specified on the label. And that goes for medicated feed as well. So it should only be used as directed. And this is the only legal way to use medications. So if a medication says that it is only for swine, is it legal to feed it to sheep or goats?
Yes.
No.
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 No, it is not. If it is labeled for sheep, is it legal to use for goats?
Yes.
No.
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 It is not. Good. Okay, so we only want to use it for the animal that it is being specified for. There's also off-label use, and this is when a producer uses a drug on their own in a manner other than what is stated on the label without, this is the key, without veterinarian guidance. So if you were to feed that sheep feed to a goat, that would be called off-label use, and this is illegal. Extra label use is doing the same thing if a veterinarian prescribes it. So if a veterinarian prescribes a medication to be used in a way that is not on the label, that is legal.
I
So
have a
if the
question.
veterinarian, yeah.
So so if you do that and you don't know, will you be eliminated? Apparently.
No, it's just not a good idea. So if you're not sure if you should do something or not, it's probably best to ask.
Okay.
I missed that.
So some types of extra label use are using more or less than the label prescribes, giving the medication
It's
more
6:40.
often, or giving the medication more often than the label prescribes or suggests, or giving a treatment longer than was prescribed. So say it says for 10 days and you decide to give it for 12 days, or to use a drug to treat a different disease than is on the label, or for a different species than is on the label. We're going to talk a little bit about how to give medications now. So step 1 is to follow the label exactly. It'll tell you what type of administration to use, so if it should be sub-Q, IM, oral, and we'll talk about all those things in just a minute. It will tell you how much to give or how to calculate how much to give and what the withdrawal times are. So it's really important to follow the label directions. And then step 2 is make sure that your family and other people know what medications you're giving, so that if they're helping with you, they know, say you're taking turns feeding the animals. If not everybody's on the same page, then the animal might get 2 doses instead of 1. And so it's really important that everybody knows the plan. And how to give the shot. So subcutaneous or sub-Q means under the skin. And to give an under the skin shot, we're going to tent the skin of the animal on the neck, and we're going to slide our needle in perpendicularly. The picture makes it look a little bit like you're going to stab your fingers, which can happen, so you need to be watching your fingers. This picture is a little bit clearer. You want to make sure that you're getting that muscle under the skin, or that medicine under the skin and not in the muscle. Intramuscular means in the muscle, and you'll use a longer needle for intramuscular shots than you use for sub-Q. And this one, it literally just goes straight into the muscle. And all sub-Q and intramuscular injections need to be given in front of the shoulder in all species. And you never want to give a shot in the rump or hind leg.
How
go ahead.
How do you find the muscle?
I'll show you in just a second.
Okay.
Right here. So we want to find this spot on their neck. Can you guys see these round spots on all of their necks?
Yes.
That is the
Yes.
muscle that we want to give the shots in. And so if you're giving a in the muscle shot, you stick the shot straight into the neck in that muscle.
I have a question.
Uh-huh.
So if you do a boy or a girl, which animal, like a boy or a girl?
You can give shots to both boys and girls.
I didn't say that.
So we want to give the shot in this triangle here, which what we kind of saw, all species have a triangle on their neck. And this is where the muscle is at. So we want to try and give the shot, if it's in a muscle shot, we want to make sure to get it in this big muscle. If it's under the skin, you can go a little bit further back, but always in front of the shoulder. Why don't we want to give shots in the hind leg?
It could get infected.
It could get infected. Good. So we talked about injection site lesions where they get infected, and that happens. If that happens, then the meat is ruined. So we want to make sure that we don't give injections in a place where the meat is a high quality product that we would end up with more waste. If we give the shots in the neck, there's a smaller muscle and the muscle isn't as widely used. So if something does happen and there is an injection site lesion, it's far less waste than if you give the shot anywhere else on the body.
We want them to see it.
So with small pigs, sometimes in lambs and goats as well, when the animals are really small, brand new, it's hard to give a shot in the neck because there's not much there. So you can use their elbow pockets to give under the skin shots when they're brand new little babies.
What is an elbow pocket?
So these two spots right here, this is their elbow pocket and this is their flank. And there's some loose skin here on those animals, and that's where you want to give the sub-Q shots to baby pigs. So here we talked a little bit about injection site lesions. You've already seen this picture. This picture is an abscess or an infection in the meat. How would you like to cut into your steak dinner and find an abscess?
I would throw up.
That would be very gross. I probably would too. So we want to make sure that we avoid this and this because this meat has to be discarded. It is not good or safe for consumption. And so we want to make sure that we follow proper administration to help avoid either of those things from happening. Okay, so I'm going to pull up I'm going to fast forward a little bit and we're going to find a video on how to give shots.
I missed it. Well, you like watched half.
All right, can you guys hear this?
No, not really.
A little bit, not very much.
Everybody practices before actually giving a shot to an animal. So here's a little video that'll show you how to practice giving shots.
All right, so we've talked about the different types of shots we can give our animals. There's in the vein, which you guys will probably not have to do, in the muscle, and subcutaneously, which is just through the skin. When you do that, we want to remember the spot that we give them is the triangle on their neck. Pigs, the only other spot we'd probably ever give them is in their armpits. But other than that, we're in the neck. We don't ever want to give them in the hindquarters. Who knows why? It ruins the meat and the quality. Good job. We don't want to have any abscesses or lesions in our meat. So we want to stay away from that area. So it's really important when we do it that we're reading our label. We know how it should be given. If it's sub-Q or if it's into the muscle, it's really important so we don't ruin our meat quality. When we're giving the shot, you want to make sure you withdraw how much air you need and how many cc's you're putting. And then you'll put it into the bottle and you push the air into the bottle, and then that gives the bottle room to suck out your medicine that you need. So make sure you guys do that when it's time. Make sure that we're not giving a huge shot in one location. You guys remember how many cc's we can give in one spot? On a steer, about 10 to a time. Okay. What about our smaller animals? Do you know how many? 5. 5. Yep, it's 5. So if we're giving our lamb 15 cc's, how are we going to do that? One in the neck is 2. Okay, so we want to keep them in the neck, but we're going to divide it into 3 shots, right? Perfect. If you're doing poultry or smaller animals, it's 1 cc. Perfect. So what I'm gonna have you guys do this. When you're giving your shot, you want to make sure you're confident. Don't be scared. Don't go up there and shake. Just when you put it into the meat, into the muscle, make sure you just put it right in, okay? And then you can just, under the skin, you can feel. And so you guys are going to do this. Your bananas are not going to hold a whole bunch. So don't put probably more than 2 cc's, and maybe put 1 cc in the muscle and 1 under the skin. And then when we're done, you get to open up your banana and see how well, if you got it between the skin and in the muscle where you were trying. So try and maybe do different sides when you're doing them. So there's a banana for everybody here. All right. We have different colors so you can see which one you want. Girls, I don't know. Here's a red one. Someone wants the red. There's a blue.
I got red.
Oh, did I hand you blue?
Did you want the blue?
Okay. Whatever. Just wait a second. Okay, you guys. So, pull it back to about 2 cc's. Okay, so number 2. Yeah, or 1, maybe even 1. You don't need much. Yep, that'll work.
About 1.5.
So you're going to put it in there. Okay, you're going to tip it upside down, push the air in. Okay, now you're going to pull the bottom part back out. You could probably go to one. I think I pull it down to this big one right down here. Good job. Okay, stop. So now you're gonna flip it over, pull it out. Okay, and one thing I didn't talk about is really important to check, make sure you don't have air in there. So here, you want to use this one? Okay. So when you flip it up, when it's inside here, you can just kind of push the air back into the bottle in case any medicine comes back in. Oh, there was one, that one's probably plugged. We'll get you a different. It's been used on bananas before. Okay, yep. So now that you're ready, so which one do you want to do first? Okay, these are long needles, so don't go all the way through and jab yourself, so just push it right into the muscle. Okay, that's good. Yep. Now push it all. Yep, you can push it all or some. Okay, yep, that's okay. The bananas don't like to hold too much, right? Okay, so now do the same thing, fill it up, smear. Oh, gross. Red looks like blood, huh? Oh, yeah. That one. Okay, tip it over. Yep. Yep. Like probably a half is gonna work. That's probably enough. Oh, that one doesn't work. That needle's a bad one. Okay. I'm gonna put it about like right there, so it doesn't hold much. Yeah, that's oodles. Yep. So now you want to just try and come underneath the skin. Yep. Now you can open it up. Good color. Yeah. Okay. So just kind of fill under the skin. Like that. Yep. You think you're through it, and then put some in there. Good job. How'd you do? I did pretty good. Was that for your subcutaneous? Yep. And now break it open and show us where your intramuscular one was. See how you did on that one. Looks like, yep, break it in half. See? Mom, how do I open it? This is the one. See how it went inside there? This looks like good job. All right, does anybody else need help? Oh, no.
I really like that little extra.
Okay, so if we were meeting in person, you guys all would have gotten to try a banana shot. Unfortunately, that doesn't work very well virtually, so we just get to watch. We're going to do a quick summary, and then if there are any other questions, we'll chat about your questions. So what are some things we need to keep in our records?
Like how many shots he had and like what kind of medicine.
Good. Yep, calculate. What does calculate stand for?
Calendar.
Or what is one of the, good, calendar?
Calendar again.
A stands for animal.
Good. So
L
we've
is
got
for
calendar,
label.
animal, calendar, label,
U is for you.
you. Good.
What is C for?
Location.
Location. Good.
E is for extra.
Extra. We're missing an A and a T.
T is for type.
Amount and type. Good. Should we store our vaccines in our refrigerator with our food?
No.
No.
It depends.
Definitely not.
No.
Good. Do all vaccines need refrigerated?
I said no. Yes.
Not all of them.
No.
Not all of them. Yeah. How do we know how to store our medications and vaccines?
They're labeled.
Label.
Good. What is one type of shot?
Under the skin.
Under the skin?
Intramuscular.
Intramuscular. Good. There's also IV or oral. What are two types of identification?
Ear notch, ear tag.
Ear tags. IV.
Good. Tags, notching,
Tattoos.
tattoos. Okay, so the next 3 points are points that are covered in levels 1 and 2. What should be in a herd health plan or a prevention plan? Does anybody remember from levels 1 or 2?
Vaccines you've given them all?
Yep, vaccine plan. So what vaccines they need and when. Your veterinarian's number, what feed you're feeding and where to find the feed and how much. If you're putting together a herd health plan or a prevention plan for somebody coming to feed your animals for you, you should also include your phone numbers and how to reach you. And any medications or anything that the animal needs. What is something we should keep in mind when we are feeding our animals?
Medicine.
Food to give.
Good. If it is medication, how much to give? How should we store our feed?
Fed a day?
Yep, we do need to know how much it needs fed a day. Good. How should we store our feed?
Like in a trash can.
In a place that where it won't get.
Don't just leave it outside like that.
Yep, in a clean, dry place. So a metal trash can or a plastic trash can works great.
It also needs to be in a place where rodents.
Good. A place where rodents can't get to it. Why do we want to keep it away from rodents?
Because they could have a disease.
Good. They can have a disease, and they might have a zoonotic disease, which means that it can be spread from species to species. All right. Are there any questions?
No. I don't have any yet.
I have, oh, yeah.
Okay. Thank you guys all so much for coming tonight. If you haven't already, be sure to put your name and where you're from in the chat box so that we can make sure you're coming. You're welcome. And if you'd like a link to this recording, it'll go up on YouTube tomorrow. And I can email you the link if you put your email in the chat box. If you do have questions, feel free. I'll hang out for a few minutes. You can feel free to stay on and ask those. And again, Thursday we will be playing Jeopardy with all of the information we covered tonight, if you want to come back for a game. Thanks for coming. You're free to go.
Thank you, Tycee.
Thank you, Tycee.
You're welcome.
Thank you.
I got a question. Can you do the same thing you did when you sent it to my mom? And what we discussed, so I can read it all?
I'm sorry, can you repeat that? I only caught part of it.
Can you send the PowerPoint and the stuff to my mom's email, and she can send it to me?
Yep, I sure can. I'll send. Do you want the recording or just the PowerPoint?
You can. Can you repeat that again?
Would you like a recording or just the PowerPoint?
Can I have the PowerPoint?
Yep.
You can also send a coin